Hi, my name is Shivam, and in this project, our team is focusing on analyzing the spread of COVID infections and its impact on different social and economic factors worldwide. First up, we are going to talk about the distribution of COVID caseloads and deaths across the globe within the last 2 years. In our visualization on the top left corner, each circle's color and size indicate the extent of virus spread in that particular country. As we can see, COVID has hit some countries harder than the others. In the visualization on the top right, we can easily see the countries that have the highest number of infections. Interestingly, the prevalence and deaths from COVID-19 infections look somewhat related to the country's per capita income. We were able to think of few possible reasons for COVID-19 to be concentrated in countries with high economic status. Firstly, more developed countries have better medical infrastructure and much larger number of COVID-19 diagnosis tests are performed. Secondly, developed countries usually have older populations, and age is a key risk factor for spreading and dying from COVID-19. Thus, developed countries are more prone to the outbreak of disease and its outcomes. Last but not the least, there is much lower air transport and passengers in poor countries than in developed ones. Therefore, the transmission of virus from early places like China, East Asia, and then Europe and the United States to the poor countries has been less likely. The visualization at the bottom left shows the time trend of daily COVID infections and deaths from January 2020 till May 2022. If we select a particular country, for example, India, we can easily see that India has observed two peaks in infection counts sometime around May 21 and Feb 2022, suggesting towards the different COVID waves in the country. Now here's Ben to talk about the impact of COVID on global unemployment and economy.
For our next dashboard within our story, we decided to look at how the COVID-19 pandemic affected the global economy. We took a look at the world as a whole and also the US in particular through three different indicators of how the economy is doing, which are the unemployment rate, stock prices, and year-over-year growth. Living through the pandemic brought great uncertainty as lives were lost, businesses were shut down, and many people lost their jobs. We wanted to look at these figures in hindsight to see how different economic indicators fluctuated based on changes in COVID-19 cases. The top left visualization looks at the unemployment rate, showing the unemployment rate in 2020 or 2021 within each country. While countries during this time period also had high unemployment rates before 2020, we still believe that this map chart is a good indicator of which countries were hit the hardest by the pandemic. The chart shows that the African countries had the highest unemployment rates in both 2020 and 2021. One of the biggest storylines of the pandemic was whether or not wealthy countries were doing enough to financially support poorer countries, and this question remains up for debate after looking at indicators such as unemployment rate. The top right visualization is a bar chart that allows you to easily see which countries that had the highest unemployment rates. As you can see, South Africa, Djibouti, and Eswatini had the highest unemployment rates in 2020 and 2021. The bottom left visualization shows stock prices and unemployment trends throughout the pandemic. We measured stock prices through the ticker VOO, which is the Vanguard 500 Index Fund ETF. It is meant to replicate the stock market as a whole, and its largest holdings include Apple, Microsoft, Amazon, and Tesla. Initially, we were confused why the stock market did so well over the period from the beginning of 2020 to the middle of 2022, while COVID ravaged the world. However, it made sense when considering when the COVID lockdowns were within the US. The lockdowns began in March of 2020, which is when many people either started working from home or lost their jobs. Once people returned to work and businesses opened up, stock prices rebounded. We also believe that the increase in stock prices may be a return to mean as the market took a hit in early 2020 and companies, especially tech and biomedical ones, began to recover. Finally, the bottom right visualization looks at year-over-year GDP growth, comparing the US to the rest of the world. GDP stands for Gross Domestic Product and is a measure of the market value of goods and services produced within a certain time period. In a world of constant economic growth, this bar chart shows that both the US and the world as a whole saw a rare decrease in GDP year over year from 2019 to 2020. The US saw a smaller decrease in GDP than the world as a whole, potentially because of hesitancy to lock down to stop the spread of COVID. The US also saw less of an increase in GDP from 2020 to 2021, however, potentially because other countries were better able to control the pandemic and reopen and expand businesses. Overall, these visualizations show that while the stock market may have done well at times throughout the pandemic, global GDP took a hit, the unemployment was highly present, and the effects of COVID continued to impact the lives of millions. Now here's Emmett to talk about mental health.
As the world witnessed, COVID not only had an adverse impact on the physical health of the population, but also their mental well-being. These visualizations focus on the measure of anxiety and depression amongst the US population as grouped by age, ethnicity, and states. The top left visualization shows us the impact that COVID had on the mental health of people divided into different age groups, filtered for the peak months. As you can see, the youngest generation was the one that was most affected by the pandemic, as they are known to be the most social, with the measure of anxiety and depression reducing as the age increased. Moving on to ethnicity, the mental health of non-Hispanic, other, and multiple races in the US were most impacted by the pandemic, with Hispanic or Latino race coming in second, non-Hispanic Black race coming on the third, non-Hispanic white on fourth, and non-Hispanic Asian race on fifth. This data goes in line with a report issued by the American Psychiatric Association, which states that ethnic and racial minorities often bear a disproportionately high burden of disabilities resulting from mental health problems in the US. Moving on to the state-level division, it is clear that the overall measure of depression and anxiety was high in most of the states during pandemic, if you compare this with the scale. However, a positive sign for all these groups is that if we select the dates after the period of pandemic, we can see a stark difference in the average data for all the factors which show the measure of anxiety and depression. You can see that for the data in states, the average data grouped by age or ethnicity as well. Moving on to Julie, who will be focusing on the data for vaccinations.
Now, let's look at the visualization of vaccinations. In this visualization, it shows the relationship between Vanguard S&P 500 ETF and vaccination trends in the US. We made a hypothesis that the more people get the vaccination, the increase in transaction volume. And from the visualization, it is the same as our hypothesis. First, let's look at the picture here. It shows how many people are fully vaccinated over time. This is an accumulated indicator that calculates the number of people fully vaccinated. For example, we can see from March 2021 to April 2021, the number of people fully vaccinated increased very quickly. Then the number of people fully vaccinated stably increased in the following months. Second, we can look at the distribution of people fully vaccinated in every state. The size of the circle shows the total number of people fully vaccinated, and the circle's color shows people's total number of vaccinated per 100. From this graph, we can see that people vaccinated is highly related to the total population of each state. For example, Texas and California have giant circles. However, the more the population vaccinated does not mean the higher the percentage of vaccination. For example, states on the East and on West Coast have higher vaccination rate, whereas states on the South have low vaccination rates. Lastly, we can look at the transaction volume after the boom to see how active the market was. The monthly transaction volume also increased when people start having their boosters. This can be interpreted as people becoming more energetic in the bull market after the vaccination. Now, Kanishka talks about death by race and location.
For the next story point within our story, we decided to look at how the COVID-19 pandemic affected different population segments, such as different races and ethnicities, as well as which age groups were the most affected, focusing on death counts and percentage distributions. It also breaks down how the locations of fatalities were distributed. The pandemic resulted in a large number of deaths, and the majority of those deaths occurred while people were being treated in hospitals. Although not as many as the hospital deaths, there were also notable occurrences of deaths among the decedents' home and nursing homes. Among the people that were hospitalized, the age group between the age of 50 to 74 years seems to have been the worst hit with the highest percentage of deaths. Deaths in people over the age of 75 were mostly recorded in hospitals or hospices. The charts here also showcase the variation in death rates across different racial and ethnic groups. When you select a race or ethnicity up here, the corresponding statistics for that group are highlighted in the charts below. As a percentage of their population, the Hispanics have the highest rate of hospitalization. And these charts provide insight into various differences based on age and heritage. Further analysis of these numbers could lead to insightful investigations into issues such as whether some communities have less access to facilities that could have maybe resulted in better care for them. Now, here's Himanshu to talk about the global COVID restrictions.
For our next dashboard within our story, we decided to look at different measures and restrictions that have been implemented by different countries and their government to control the COVID-19. On the basis of this dashboard, we wanted to see how many and what are the different kinds of restrictions that have been applied. The top right visualization separates the world on the basis of different regions. This world map is basically for user to select any country on the basis of which they can filter the specific measures that have been adopted by that particular country. For example, when you select India, the left bar graph shows the specific measures that has been adopted by India to control the COVID-19, and the x-axis on this bar graph represents the count of those measures. That is, how many times that country has applied that particular measure. Like here, visa restrictions has been applied by 9 times by the Indian government during the COVID period. The bottom right visualization shows the count of the broader categories under which the specific measures were taken. For example, like in India, there's a total of 64 public health measures were taken and 38 governance and social economic measures were taken. The sum of count of each of these broader categories will be equal to the sum of the count of these specific measures. For example, in Afghanistan, the sum of these measures is 58 and the sum of the specific measures is also 58. We can also select a date if we want to find out some particular measure that has been taken during that particular time period. So when we select a date range, for example, from 4/15 to 2020 to 1/5/2021, we realize that there are only 3 movement restrictions and 4 public health measures that has been taken in Afghanistan. So it's total 7 measures, and we have 3 strengthening public health system measure, 2 as border closure measures, 1 is international flight suspension measure, and 1 is awareness campaign. So the sum also comes out to be the 7. Some of the countries gets white in the graph when you restrict the range. This shows that no particular measure has been adopted by that particular country during that particular time period. This was all from our team. Thank you.